Hello, this is Mayor Brian Arrigo. Welcome to my monthly nonprofit spotlight. Each month, my office will highlight one organization doing great work in our community. For more information about all nonprofits in the city, please visit revere.org and under the Residents tab, click on Nonprofits and Community Resources. If you know of any organizations doing great work, please let my office know. Thank you and enjoy the interview.
Hello, Revere. Welcome to Mayor Brian Arrigo's first nonprofit spotlight feature. My name is Joe Gravelisi, and I'm the aide to the mayor. And I'm joined today by staff and someone who participates in the East Boston Neighborhood Health Center's Elder Service Plan, which was selected for the first edition of our spotlight feature. So welcome. With us and here to tell us a little bit more about what the Elder Service Plan does is John DeSecca, Lucas Ackerley, and Ann Sullivan. So I'm going to let John take it away and introduce the program a bit and talk a little bit more about what they have to offer to seniors in the community.
Great. Well, thanks, Joe. Thanks for having us, and we're certainly excited to be nominated, and certainly as a new business in Revere. A lot of you may know that we just moved to the 300 Ocean Ave location this past spring, so we're excited to be in Revere now and participating in a number of different ways. But a little bit about the Elder Service Plan. We're actually a PACE program, which stands for Program of All-Inclusive Care for Elders. It's a jointly funded program through both the state government and the federal government, and we actually currently have close to 100 participants that live in the city of Revere. We do service 10 local cities and towns, one being Revere, so we're certainly happy to be in Revere again. And but the Elder Service Plan it really is able to serve a number of different types of folks. Criteria such as people that need to be 55 and up, certainly live in our service area, and also have a certain amount of health care needs. And people can get subsidized through the federal and state government, but they can also pay privately as well. So, folks that are interested, I'm sure we'll give out the phone number at the end and how folks can call us. But again, we're excited to be here in Revere and looking forward to partnering with a number of folks in the town.
Fantastic. So just explain briefly for people that don't know what the PACE program is.
Sure. So it's a managed care type of program. It's an insurance plan, but the East Boston Neighborhood Health Center is also the provider. So we're a provider and the insurer. And we have a number of different services, very vast number of services, but most services are provided out of our PACE centers. We do have one in Winthrop and two in East Boston. And then we certainly have a wellness center also in East Boston. But we are expanding services into other cities and locations, and Revere is a big part of that. So folks will receive their care at our PACE centers, and then there's a number of different other touches, as I like to say, which Ann and Lucas will talk about when it comes to transportation, when it comes to primary care, specialty care, Meals on Wheels, food transportation or food deliveries. I can go on and certainly love for these two folks here to talk a little bit about it as well. But it's a fantastic program, and we certainly would love to talk to more people about it and educate them on how this could benefit them.
Fantastic. And before we talk a little bit more about some of those additional benefits, so just to make sure that if I understand correctly, if you have both Medicare and Medicaid, it coordinates those services, correct? So that everything is kind of all encompassed and it makes it a little bit easier for the patient?
Correct. So if folks are currently, let's say if they're on Medicare and Medicaid, which are some of our folks, not all, they'd be considered duly eligible, and then what happens is that the Elder Service Plan becomes the primary insurer. So we essentially take over for those two entities and become the primary insurer for the participant or the member.
So let's get to the fun stuff. So we have Lucas Ackerley here. I believe your title is Activities Director? Is that
Recreation
right?
Therapist.
Recreation Therapist. So tell me a little bit about
Winthrop. So I work at the Winthrop Center, and so the whole goal of our program is to keep people in their homes as long as possible. So we provide transportation to the day center. At the day center, people can get their medical needs met, as John talked about, and as well as social needs. So we have a lot of programs that revolve around socials, lots of like coffee socials, different parties, We also try to do programs that are spiritual, like are beneficial for people's spiritual well-being, emotional well-being, physical well-being. While people are at the PACE centers, they can receive PT, physical therapy, occupational therapy. There's social workers for mental health care, as well as primary care, as we mentioned earlier. So,
Fantastic. And so, Ann Sullivan, how long have you been part of this plan?
I've been going to the Winthrop Center for 3 years now.
So tell the folks at home a little bit about why you've enjoyed it so much. And I should point out that Ann, who's a Revere resident, was the one to reach out to our office and nominate these fine folks as the first Spotlight recipient. So I'm sure she has a lot to say about what they've done for her.
Yeah. Well, first and foremost, I get all my medical care there, which is very important to me because I'm a diabetic. And not only medical, but the social aspect is very important to me too, because Lucas has a wonderful program, and I take part in just about every activity and field trip that we have. We just had a field trip to the Winthrop Arms restaurant, and we had a wonderful time, and usually at least 10 people go, about 10?
Yeah.
Yeah,
About 10 people.
about 10 people go, and we take the shuttle bus that's provided from the center to the field trip. But
So what are some of the other field trips or activities that you've enjoyed?
we go to the movies.
At the Revere Cinema, there's a senior day, so we always try to take
Oh
advantage
yeah,
of that.
senior
and
day
do
on
it.
Wednesday.
The last outing we did, we also went on a boat ride throughout Winthrop Harbor
Nice.
in East Boston. That was really nice.
Yeah.
We do different restaurants, which are always very popular.
Yeah,
So,
yeah.
I'm sure the Winthrop Arms was a hit.
yes.
Oh yeah,
Yes.
it was definitely a hit.
Hopefully come into Revere a few
Yeah.
times
Oh,
as
yes.
well. All right. I don't know if there's any
We-
restaurants that are your favorites over here.
Well,
Domino's.
Okay.
Yes.
Yeah.
And we do see the sandcastles once a year. We
Oh.
try to do that, make that a
Awesome.
priority. So,
Now, how many people from Revere would you say are part of this program?
It's close to 100 now.
Wow.
Close to 100. So, and you know, and again, with our presence here, and you know, we're certainly looking to bring this program to as many people as possible. And you know, the great thing that Lucas talked about primarily is that it allows people to stay at home. There's certainly a lot of other options for folks, but our program really, as I call it, kind of is more kind of a wraparound, all-encompassing that can really provide so many different types of services, which you know we've talked about, that just allow people to remain safe in their home. One thing that I know hasn't been mentioned yet is we do provide home care, private duty home care, homemaking services for folks as well. So again, trying to allow folks to maintain a high level of independence in the home or homes they've been in for 10, 20, 30, 40 years.
Could you speak a little bit to the importance of that social and recreational aspect in allowing people to stay in their homes?
yeah, so a lot of people who come to our program, the only time they come out of their homes is to our program. So we really value that when people do come out, that they have to benefit socially from it. Because a lot of times, like I said, it's the only time people get out is to come to the PACE Center for medical care, and we also want to provide some social kind of environment for people to thrive. So,
And how long have you been there for?
I've been there for about 3 years.
Great.
So.
Awesome.
Yeah.
Well, thank you for coming out and for everything you do. If you want to tell people watching what they can do if they think that either they or a relative might be eligible for these services, what are the steps and who they should reach out to?
Sure, yeah. We'd love for folks to call us to inquire about the Elder Service Plan. We're again right in Revere on 300 Ocean Ave. We'd love for folks to pick up the phone and give us a call. And we can be reached at 617-568-6377. And I'll say it again if I can, 617-568-6377. And we'd love to talk to as many people about, again, this wonderful program.
Excellent. Well, thank you all for coming out. Thank you for watching. And,
Can I say one more thing?
Absolutely.
Okay, I'm a Revere resident. I live at Prospect House at 420 Reservoir Avenue, and we have 109 residents, and of the 109, 62 people are members of the PACE program.
That must make
So
it a
that
great
speaks for
environment.
it very highly.
So people tell their friends, then they want to participate in
Right.
it too. Well, that's
Yeah.
great. And if you know of any other great community organizations that are doing awesome work in our community, reach out to Mayor Arrigo's office. You can call 781-286-8111 or email the mayor. He'd love to hear from you at revere_mayor@revere.org. Tell them a little bit about the organization that you work with and what they do, and maybe we'll see you here next month on Revere TV. All right, thank you everyone, and have a good rest of your day.